I have been interested in science and the way that the human body works for as long as I can remember. I remember even as a child playing outside and gathering leaves and flowers and making these formulas that I called medicines. So it really started at a very early age for me. My mom as well was a really big influence on my love of naturopathic medicine, though at the time I didn't know that. I just remember we always had a garden and we always practiced mindful, healthy eating. She was the one that taught me that everything that you put in your body, including what you eat, has a huge impact on your health, and how important it was to make sure that we were staying physically fit and active. So it really started for me at a very young age. As far as going into medicine, I did pursue working in the conventional healthcare field earlier in life, and I worked with many different healthcare professionals and doctors, and what I became a little bit disillusioned with was that I never saw doctors talk about how to stay healthy or how to prevent illness or disease, and in fact that wasn't taught at medical school. What I saw over and over was one or two symptoms being masked or covered over with medication after medication. And I really thought that there must be a better way to view the body as a whole and to help people learn how to take control of their health and stay healthy. My sister suffered in her early 20s with a disease that conventional medicine was really trying hard but just struggling to help her get better, and she got better through the help of a naturopathic doctor, and that's when I was really introduced to the field of naturopathic medicine. And it was from then on that I really decided that that would be the avenue of medicine that I wanted to pursue. So a typical appointment with me is very different from what a patient may have experienced before with a conventional healthcare provider. My initial appointments last for 1.5 to 2 hours, and we take a very deep dive into their healthcare journey and medical history, sometimes dating as far back as childhood or even birth, depending on the patient's particular situation. We work together as a team to figure out if there is a dysfunction in your body, what happened to make that dysfunction become a reality, and how can we get back to the root cause of what caused the illness for the patient, and how can we move forward together to create a health care and a treatment plan that'll be sustainable for the patient. The great thing about naturopathic medicine, and the thing I really love, is that naturopathic medicine empowers the patient to take control of their own health and their own healthcare journey, and how going forward they are going to be able to take care of their body in the best way for them. So naturopathic medicine is really a partnership between the doctor and the patient, and just learning more about their body and why any sort of disease or illness has arisen for them, and how they can take control of that and become the steward of their own health. I can offer help in many different areas of healthcare. My main goal with every patient is to find the root cause of their illness, to really figure out why their body is experiencing dysfunction and illness, and work from there. I am licensed as a primary care doctor in the state of California, so I'm available to be the patient's primary care doctor. However, if they already have a primary care doctor, if they're working with other specialists, I'm available to provide complementary or supplemental care for that patient. It really depends on the patient's needs. I do have special interest in chronic infection and chronic illness, in pediatrics, and hormone balancing for men and women, and for mental health care.